what are the things you're deciding now?
We were communicating for the 4 things which previously for my broad eyebrow reduction and there was zygomatic reduction and rhinoplasty and the hairline also we were discussing. So after that you had in November we had done this WhatsApp this video chatting here. You told that forehead reduction from the scalp area, but not touching the eyebrow area. That is what you have mentioned. Then malar bone reduction 3 mm only, and rhinoplasty correction in middle of braids. That is with including the rib type. And FU hair transplant after 20-25 days. You told.
Or even later.
Yeah, even later also. So right now I'm looking for that one more. This 3 mm is okay, but if you can add, this with the rib, this here.
Lower jaw?
Yeah, lower jaw. That is with PCM.
See, lower jaw, if you want this part, I can do genioplasty. But if you want me to add on the sides, we'll have to put some artificial material.
Artificial. But what about with the screw and PCM? With the
peak?
Yeah, only to add, but it's like just a little broader.
We can do that. Yeah. But I have to put up artificial material.
Need artificial, but you can do it with the same cartilage, right?
No, cartilage will not work well there.
It will not work?
No. Because I have to fix it with a screw or something, so cartilage won't work. This we can narrow it, we can increase the height, all that we can do, this we can do, this we can do, this we can do, this we can do. But lower jaw, I can do, but I need to put up artificial material. Okay, so I can't use rib for the lower jaw.
Makes a difference after like 1 year.
Artificial material, there's always a small risk that it gets creates some issues after a few months or few years. Little bit risk is there extra. I have to remember that. Nose, when I put the rib, it stays like that. Your own rib, it will fuse for life.
Okay, and it will not dissolve, right?
No, it will not dissolve. But here, if I use, it won't dissolve. But artificial material can sometimes rarely move because it's in this area, right?
Yeah, like this one. This two.
Yeah, both the angle.
Yeah.
We can do that. But you have to remember that it can move a little bit. We can increase it a little bit. How much do you want it to be increased?
Like when you're talking about 3 mm reduction zygomatic, but if there is a slightly improvement in this side, it will make a little parallel and it will, that zygomatic, that little, if it is coming outside, it will be, this one will be like it's normal.
Yeah, 3 to 5 mm we can do maximum. We can do that. So what else are you, all this is we can do. Forehead reduction, what exactly you want?
You were discussing about reduction, not brow reduction, it's scalp area you have talked.
Yeah.
With the inside.
I'll make an incision there, yeah. No, but what you want to be changed?
Here actually I was discussing with you for this one. This part, it's little protruding outside. But
so here you do then. Here that bone you do.
Yeah.
So I'll have to come from here.
Okay.
And remove the bone from inside.
From here. Inside that part. And so this is what which you had mentioned that time, right? Okay. Then. So.
When would you want me to do all this?
I am totally available till March. I think really March end. I am here.
So you can talk to my executive and tell him you want it done like this week, next week, whenever you want. He'll give you an appointment, and you can come and you can start.
Possible if you have time on this week?
Yeah, this week also it will be possible. I'll tell him. Might be able to do it tomorrow itself. I'll just ask him. In Rijo ke paas bhejna inko. So you just talk to him.
Yeah.
I've written all the procedures what you're going to do. And accordingly you talk to him and then we can. Rijo done good.
Come.
Yeah. Any doubt you can see me again.
Yes.
Yeah.
Hello everyone, we are here with a patient who is all ready for an extensive surgery. I say extensive because it is going to be on the upper 1/3 and the middle 1/3 of his face, also possibly the lower 1/3. Now this will be kind of a face makeover surgery. The patient's desires are very specific. He wants sort of reduction. In his terms, it's the eyebrow reduction. It's basically the supraorbital rim or the arch, as we can say, that he wants reduction. So it's forehead reduction or frontal bone work for him. It's going to be a bicoronal incision that we say, or a transcoronal. The approach has to be from the forehead such that we can reach the supraorbital rim or the bone, and the frontal bone is exposed completely. So if he turns on one side, he doesn't like this protrusion. He's desirous of a forehead which is flatter compared to the bulges, as we can see. Second desire happens to be with cheekbones. So if you can look straight, sir, he wants malar bone reduction. It has been counseled that he doesn't require as to too much osteoplasty. It is not going to be an extensive osteoplasty in terms of the malar bone. That's because at the skin and the cheek region or the middle 1/3 becomes loose and saggy. The third thing which the patient desires is about the nose. It's the rhinoplasty. Now, if he turns on one side, just turns up, the patient is not desirous of the dip or the depression of the radix, as we can see. So the transition from the radix to the dorsum is not very continuous. We see a sharp dip or a bend here that the patient wants to be bridged in or filled in. Also about the nasal bridge, a little bit of augmentation is what he's desirous of, some tip work, the width and the alar base. Yes, so as he's looking up, we can also see a view at the alar base. Especially his complaint is when he smiles, the alar base gets a little flared. The third complaint also, or the fourth one, so as to say, is about chin as well. The doctor has counseled him, that we have seen his scan. Minimal improvement can be achieved with that by minimal augmentation. So it's a full face work for him, a face makeover of sorts. Going to be extensive because the approaches to each part of the face will be different. It will be in different approach for the forehead, a rhinoplasty, a different approach, and for the jaw, it will be a different approach. So it's going to be in 3 subunits for the same patient. It will be an extensive one. We'll cover it and show it as to how it comes and also follow it up before he leaves. Thank you.
Jaw sculpting for this patient. So he wants a really strong masculine male chin. That's what we're gonna do. We're gonna increase both the vertical and the horizontal dimension now. So just completed with this chin augmentation, both horizontal, vertical augmentation. We've improved his double chin. We've got that male chinoplasty, jaw sculpting done for him. And this is him after surgery. There's also a lot of swelling. What we've done is 8 millimeters of vertical and 8 millimeters of horizontal augmentation. You can see he's got what we call as raccoon's eyes because he's got circumorbital ecchymosis. He also has subconjunctival edema, subconjunctival ecchymosis. Now, this is because we did surgery on the eyebrow, rather the bone inside the eyebrow. So we corrected that, we reduced it. via a bicoronal incision and approach. And we're going to show you that. It hurt a little bit. You know. So you can see the staples. These are like zippers, these staples. We would take them off on day 10. But you see the healing is very nice. There's no edema anywhere. This is all the area marking from my surgery where we contoured the forehead, the supraorbital rim, up to the nose. And then we did nasal procedure, augmented the nose, chin also, malar bones, both the sides. And I'm going to take this off. It's going to hurt you a little bit. Maybe, sorry, a little bit too much. Sorry. Right. కొంచెం కూడా స్ప్రే దాకా already soaked, but still we'll apply a little bit more. Yeah, so all this is even after we've soaked it, because this is somehow okay. Some more. Yeah, no, I'll put that. Okay. I think eventually there will be, yeah, done. Sorry about that. So we finally finished. And this we have to clean up, okay? And there's a lot of swelling there. And the nose, it's not going to hurt so much. It's going to be, well, compared to what you went through, a little bit less. Earbuds. So we're going to put steri strips for him still, because the bone here isn't consolidated, as you can see. But you've got a much nicer profile now, much nicer front look too. So you can see the severity here has gone down. The malar bones, you see how it was earlier, how it is now. It's smoothened out, and you can have a look also, sir. You can just see the differences now. So the nose is pointy, raised. This has gone down, ribbons come off. And it will get much better, okay? Only 8 days with time. Look at your double chin now. It's gone. On the here you can see the double chin. You can look at that in the mirror. You can look at the double chin is gone. Chin has become more protrusive, more masculine. There's all a lot of swelling. But we've done surgery for him right from here till here. So it's like a craniofacial surgery. Forehead contouring, supraorbital rim work, radix, dorsum, tip, alar base, malar bones, buccal pad fat cheek contouring, osteotomy, genioplasty, and jaw sculpting. So that's pretty much the entire facial skeleton along with the cranium. And we did it all in one go, from the bicoronal through the open approach, from intraoral osteotomy, all done in one go. It took us about 7.5 hours. But the advantage for this procedure for the patient is it gets everything done in one go. And that's simply the biggest thing, that you just get everything done in one go. Yes, but it's a major surgery because we've used so many things. He's also desirous for hair transplant, which we'll plan a month or even later than that, in no hurry. So this will all resolve. So he had a lot of swelling to start with. Obviously, he couldn't open his eyes for a while. And you're having any pain from the rib harvested site?
No, that is less now.
Less pain now.
Only like here.
That side is side pain. Because swelling, there's a little swelling. Can you see that? There's some small swelling, both the sides. So that'll resolve on its own. It'll take maybe 2-3 more days. As the swelling is coming down, that will also come down. All right? Take care. Stay with us some more days. Once we take this off, we'll send you. Thank you.